I now invite Dr. G.R.R. Chakravarti, HOD, Department of Swasthata Department, to present the memento to Dr. Murli Krishna Sir as a token of gratitude. Thank you, sir. So now we are concluding this session.
Thank you, sir. Thank you, Roshni. Now moving on to the second scientific session on management of PAKSHAGHATA, an Ayurvedic approach. For that, now I request Dr. Ravishankar Pervaje, sir, to grace the dais. Thank you, sir. It's my pleasure to introduce Dr. Ravishankar Pervaje, sir. Sir completed his BAMS in SDM College of Ayurveda in the year 1985. Sir completed his post-graduation in Banaras Hindu University in the year 1989. Sir started his career as a surgeon and Ayurvedic physician at Puttur in the year 1989. In 1991, Sir developed Pratisaraniya Ksharakharma and Agni Karma in different conditions like piles, fistula in ano, fissure in ano, anorectal prolapse, etc. Sir conducted workshop on Ksharakharma and Agni Karma in piles at Sanjeevani National Conference, Mudbidre. Sir conducted Ksharakharma and Agni Karma in piles free camps once in a month for 6 months at SDM College of Ayurveda, Hassan from August 1999 to 2000. Sir worked as a visiting faculty at SDM College of Ayurveda from 2001 to 2004. Sir published research papers on Ksharakharma and Agni Karma in different types of piles in Nima Journal, Ayurmedline, etc. Sir established a Sushruta Ayurveda hospital at Puttur in the year 2002. Sir presented a guest lecture in different seminars and different Ayurveda colleges on subject of Ksharakharma, Agni Karma, Rakta Mokshana, etc. So till now, Sir treated more than 2,000 patients. To honor this great scholar, I would like to call upon Dr. Guru Prasad, Assistant Professor, Department of Swasthata, to honor this honor with a shawl and a garland on behalf of Sri Jayendra Saraswati Ayurveda College and Hospital. Thank you, sir. Now I request Dr. Ravishankar Pervaje, sir, to start the session.
Management of acute stroke by Ayurveda. So what is acute stroke? See, stroke can happen by hemorrhage or occlusive. Occlusion may be by thrombosis or embolism. It may present as transient ischemic attack, lacunar infarct, infarction of anterior middle posterior cerebral artery. So evaluation of stroke means patient initially comes with just weakness in one side. He will continue to have complete hemiplegia. It is all related to area involved, minor to major vessels involved in hemorrhage or infarction. So what happens? Prognosis is according to age. If older age, prognosis is bad. If a big area involved, prognosis is bad. Earlier age, small area involved, prognosis is better. What happens in stroke is, see, a small area, where is lighter, this one, yeah, small area, there is infarction or hemorrhage, it is complete death occurs. Around this, a big area of inflammation. It is a reaction to this thrombosed area or hemorrhage. Due to this inflammatory swelling, there will be big area of congestion. Congestion is decreased blood supply to the brain area. So here, how much fast aggressively you treat and reduce the inflammation, that much fast congestion decreases, patient will wake up. If you are slow in treating, what happens? Inflammation increases, like that congestion also increases. A patient comes walking to your clinic, he will become completely hemiplegic. He will lose the limbs. So in this area, you must be very aggressive, very fast to reverse the pathology. So resultant presentation, patient may present to you in clinic as a disorientation or unconscious or coma, or may present with convulsions, weakness in contralateral part of the body, that is hemiplegia, or he may present with death also. This is all according to age and area involvement. Usually there will be increased blood pressure if patient does not go into shock. If he went into shock, usually BP will be reduced. Don't think in always stroke means there should be increased blood pressure. There may be decreased blood pressure also in some cases. So management in hemorrhage, there is no actual treatment in management for a cause. Only you are managing the situations, correction of electrolytes, IV fluids, RT feeding, Foley's catheterization, oxygen inhalation, diuretics, antihypertensives. Outcome cannot be predicted. Patient may die or may recover with the permanent disability. In infarction, there is some thrombolytic drugs developed recently. It should be given within 3 hours of attack. He should present you in a clinic, then you have to diagnose it is a infarction, then you have to treat. And antiplatelet drugs like icosapent, etc. only prevent the further increase of the stroke. And if complication is there, you should treat the complication accordingly, like seizures, electrolyte imbalance, aspiration, pneumonia, etc. Early passive movement after stabilization, physiotherapy and rehabilitation. So like this stroke means, don't think it occurs only due to infarction hemorrhage. It may occur due to infections like tuberculosis or growth or road traffic accidents, like that. In such cases also present as stroke. Though stroke means, don't think only infarction or hemorrhage. By all these causes, patient will present with the stroke. So how this is all modern management, modern diagnosis, modern management. How it should be treated according to Ayurveda. See, for any disease in Ayurveda, there is one dictum is told in Charaka Samhita in first chapter. What he says, Hetu linga vashadam jnanam sasthatara parayanam. Patient presents with the linga, signs and symptoms. In this case, he comes with the one-sided weakness, unconscious, convulsions, all these things. What you have to do, you have to find out what is Hetu, cause. To that cause, we have to give the treatment. That is Hetu linga vashadha, jnana. This is very important in all the cases. Here, that means he says, in Ayurveda, it says you should treat according to cause and effect. These are all effects, signs and symptoms. You have to find out cause. To that cause, we have to treat. Even Western medicine also developed on the same concept of cause and effect Siddhanta. Now, what is the difference? See, in Ayurveda, you see, cause and effect is explained on the basis of doshas. Nasti rogo vina dosha yasmat asmat vichakshana anuktamapi lingehi vyadim upacharet. You see, this sloka, a very famous sloka of Sushruta, it has two meanings. It has inner meaning. Nasti rogo vina dosha means without dosha there is no roga, and also without dosha there is no aroga also. For arogya also there should be dosha, for roga also there should be dosha. When doshas are samavastha, there will be arogya. When doshas are vishamavastha, there will be roga. So then comes, he says, when anuktamapi doshanam, even if it is not told, you have to see the doshalinga in vyadhi, then we have to treat. Anuktamapi, even it is not told. Inner meaning is, even it is told also, without seeing dosha, we should not treat any disease. Where you have to see the doshas? In the given vyadhis. Here what is the vyadhi? One-sided weakness. Or for example, a gridrasi comes. Kati prishta uru janjangayo vedana. That is shula. There we have to see the dosha. Where? In that roga only, shula only. If it is kevala vata, there will be severe pain. When pitta samsarga, there will be daha. And kapha samsarga, there will be numbness. So you have to see the dosha linga. Where? In that vyadhi, then we have to treat. Not just gridrasi means giving katibasti, matravasti like that. No, it is not correct. If it is kapha samanvita, you have to give ksharabasti. If it is pitta samanvita, you have to give kshirabasti. If it is kevala vata, you have to give kevala kashaya and tailabasti. This is the common knowledge of any Ayurveda students. Like that, in this Pakshaghata also, so what we have to do? We have to see the doshanam linga in presenting vyadhi. That is why in Charaka he says hetu sthana visheshat bhaved roga visheshaha. This is again very interesting sloka of Charaka Samhita. Hetu sthana visheshat bhaved roga visheshaha. For differential diagnosis, how you have to do? In Ayurveda we have to do different diagnosis too. In modern science they do different diagnosis according to vyadhi. But here we have to do different diagnosis according to vyadhi. One is vyadhi means sthana samshaya. Where is sthana samshaya? That is why he says sthana visheshaha. What he said? Dushya prakupita sorry, here sthana vishesha koshtadi koshtagata sandhigata snayugata, that is sthana vishesha. Wherever sthana samshaya occurs, according to vyadhi will be presented. Hetu vishesha yatha dushtena doshena. Is it pittavarana, kaphavarana? It may be vata vyadhi, vata roga. How vata prakopa has occurred, that is the hetu vishesha. Not to viprakrishta kalartha karmana rogo, sorry, kala artha karmas, these are different causes, external factors. By this what happens in our body, that is hetu vishesha. Yatha dushtena doshena. Is it dhatukshayat vata prakopa? Is it avaranat? If it is avaranat, it is pittavaranat, kapavaranat, raktavaranat, yatha dushtena doshena. This is hetu vishesha. That we have to find out in all the presenting patients before giving the treatment. So it may be in a pakshagata, it may be dhatukshayat vata prakopa or raktavarana vata prakopa. You cannot give same treatment for both pakshagata. Your treatment will differ according to hetu vishesha. This is a very important understanding before giving the treatment. It happens in any disease. Like then here first let us understand sthana vishesha presentations. Here in pakshagata they present with the sthana vishesha. What is the presentation symptoms of sthana vishesha? Hatvaikam marutaha vamam bhakshana, left sided or right sided there will be weakness. Then there will be chesta nivritti, ruja and vakstamba. These are the signs and symptoms of sthana vishesha. What is sthana vishesha in pakshagata is tiryagadama prakupita vata. What he says, prakupita matarishva is vata dosha. Yatha matarishva prakopa he has not told. He has told prakupita vata sthana samshaya at tiryagadamani at urdhva dehaga. Then there will be anyatara paksha sandhibandha occurs. So sthana vishesha in this condition of pakshagata always tiryagadamani at urdhva dehaga. Prakupita vata sthana samshaya at tiryagadamani urdhva dehaga. So that there will be anyatara paksha sandhibandha occurs. So sthana vishesha tiryagadamani urdhva dehaga. Then we have to find out. Then comes akshepaka, because usually in pakshagata in acute state they comes with the akshepaka convulsions. That is there he says muhu muhakshepe gatrani. Again and again there was sthana samshayaka, there will be akshepaka. The cause he says same thing. Then this pakshagata usually according to hetu vishesha, how many types? Usually everyone say Ayurveda is pakshagata means only vata. But what he says, so Shruta says Shuddha vataha hatam paksha krija sadhya anya dosh samsrushta is sadhya kshaya hetukam asadhya. That means it becomes 5 types. That is, one is kevala vataja, it is krichra sadhya. When anya dosha samsrushtaja, pitta samsarga, kapha samsarga or both kapha pitta samsarga, another 3 types. That is sulabha sadhya. Then comes kshaya hetuka is asadhya. Here question comes, what is the difference between kshaya hetuka and shuddha vataja? Because vata prakopa there should be dhatukshaya. Then he says rakta srutijanya kshaya hetuka is asadhya. Viruddha ahara viharajanya kevala vataja is kricha sadhya. But kapha pitta samanvita is sulabha sadhya. Now the patient comes with the stroke. They come with the semi-conscious, unconscious, all these things, symptoms. Now what is this? Can we treat these things? Then what he says, how you will know is it pitta samsargaja or kapha samsargaja? For that, what Bhava says, Daha Santapa Murcha Syu Pitta Samanvite. When Murcha is there, Madha Murcha Sannyasa is there in a patient of Pakshagata, such a Lakshana is there, that is Pitta Samanvita. Gaurava Shota Shaityani, Gurutva, heaviness, all these symptoms are there, then that is Kapha Samanvita. Usually, stroke patient, what we see in initial stage, they come with Daha Santapa Murcha. They come with Madha Murcha Sannyasa, unconscious, semi-conscious or coma, and at the same time they will have numbness, tingling sensation, heaviness. This is both Kapha Pitta Samanvaya symptoms we see. That means whatever patient comes with the stroke in acute stage, they are nothing but Kapha Pitta Samanvita, Vataja, Pakshagata. But some patient may come with the Dhatukshaya Vataja, or some patient may come with the Raktasrutijanya. Raktasrutijanya means don't think intracerebral hemorrhage. Because now we are diagnosing intracerebral hemorrhage by seeing CT scanning. At the time of Sushruta there was no CT scanning. At that time there was Yuddha was going on, cut wound is there, that is excessive bleeding, extra bleeding. So that patient will go to Akshepaka stage or Pakshagata stage, that is Raktasrutijanya Pakshagata, that is Asadhya. Intracerebral, it may be, they are considering it as Pitta or Kapha Samanvita according to signs and symptoms. If patient is having Daha Santa Murcha, it is Pitta Samanvita, Gaurava Shaitya Shotatman, it is Kapha Samanvita. Like that you use to diagnose and give the treatment. Now here comes, this Madha means, you see, usually we say, oh, Madha is Pitta Samanvita, but again Madha, in a patient, when they come within 3, 4, 6 hours of attack, they come with Madha, semi-conscious state. It is not same. It may be Vataja, Pittaja, Kaphaja. Again, you have to differentiate. If a Vataja Madha is there, if in a Pakshagata he comes with the irrelevant speech, irrelevant behavior. When Pittaja Madha is there, he will have Krodha and Purushabhashya. He spit on you, hit on you, like that, their symptoms will be there. A Kapha Samanvita, Alpa Druta Bhashyam. He talks very less dull headed with the semi-conscious state. That is Kapha Samanvita. Your treatment may not be same. Don't think Madha means give same treatment for everybody. If it is Vataja or Pittaja or Kaphaja, your treatment will differ according to presentation. That is why we have to diagnose at that stage. This is a very important stage of diagnosis. Then this Madha usually occurs due to Tamo Avarana. Rasa, Rakta and Mano Srotas is blocked by a dosha. You will have Madha Murcha Sannyasa. Madha Murcha Sannyasa is same disease of 3 stage. Madha Murcha Sannyasa, mild, moderate and severe. Usually there will be Chesta, Rasava Srota, Raktava Srota and Samjna Srotas is Avarana by Tamo dosha. You get Madha Murcha and Sannyasa. So now, till now, we have to see in the Sthana Vishesha. According to Sthana, Sthana Samshaya Tiryagadamani, you are having these diseases, Akshepaka and Pakshagata. This comes with these signs and symptoms. Now coming to Hetu Vishesha, what Hetu Vishesha says? Pitta Avarana. Pitta Avarana means, it may be Rakta Avarana, Pitta Avarana, Mamsavarana, Vedavarana, by any means there will be Vata Prakopa. But in the context of this one, that we have to analyze. Now what is Hetu Vishesha? Hetu Vishesha means, that is Samprapti. He says, Yatha Dushtana Doshena, Yatha Chanasura, Yatra Sthana Samshaya. These 3 things, in all the cases we have to, diagnosis means we have to do all these things, we have to analyze. That is analyzing of pathogenesis. So Yatha Dushtena Doshena, Yatha Mata, here we have to see Yatha Matarishva. There he said, Prakupita Matarishva gets Sthana Tiryagadam, you get Pakshagata. Then we have to analyze Yatha Matarishva Dushti, Yatha Vata Dushti. Yatha Vata Dushti, what Sushruta says, famous shloka is there, Vayoho Dhatukshayat Kopo Margasya Avranechancha. Vata Prakopa may be Dhatukshayat Vata Prakopa, Margavranat Vata Prakopa. By Ahara Viharas, all these things, Dhatukshaya occurs, Vata Prakopa, gets Samshaya, get Pakshagata. By Ahara Viharas, Avarana occurs of Vata by Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Majja, Shukra, Mutra, Anna, Vit. By any means, Vata Prakopa, Prakopita Vata, gets Samshaya, get any disease. So then comes Cha. Cha means Dhatukshaya due to Margavarana. Dhatukshaya due to Margavarana. So that I will explain later, what that concept. So by Ruksha Shita Viruddha Aharas, Dhatukshaya occurs, Prakupita Dhatukshaya, Vata Prakopa, gets Sansamshaya, you get Vata Vyadhi. It is generalized for any Vata Vyadhi. That's what I am explaining. Then comes Margavarana. Margavarana by Kapha, Pitta, Rakta, Mamsa, Asti, Majja, Shukra, Vitta, Mutra, by anything, Vata Prakopa, Prakupita Vata, gets Sansamshaya, you get the disease. Here, very interesting thing is, when the Kapha, Pitta, Avarta Vyadhi is there, if you see the Kapha, Pitta, Avarta Lakshana, it is, that Lakshanas will be Sarvangaja Lakshana, Sarvangaja Vyadhi Lakshana will be there. Whereas Raktavarana Vata Prakopaja Lakshana will be Ekadeshaja. Wherever Raktavarana occurs, then that area there will be pathogenesis. Whereas Mamsavarta, Medavarta, Astyavarta, these things will be in that particular Srotas. For example, for Mamsavarta Vata, he explains Arbuda, Granthi, Galaganda, all these things, Mamsavarta Vata Prakopa. In that particular Srotas, Mutra Varta Vata Prakopa occurs in Mutrava Srotas Vyadhi. In that particular Srotas occurs. Whereas Kapha or Pitta Varta will be Sarvangaja Vyadhi, whereas Rakta Varta Vata can occur anywhere in our body. Now here, this like this Prakupita Vata gets Samshaya, you get Amashaya Gata, different Gata Vyadhis. These Gata Vyadhis are Sthan Samshaya, Avarana Vyadhis, how pathogenesis occurs. That's what he explains. Now here, this concept of Cha means Dhatukshaya, first initially in Cha what happens? Dhatukshaya due to Margavarana. That means in initial stage, Avarana pathogen symptoms are more. As time goes on, Avarana pathogenesis comes down, Dhatukshaya takes over. So it's very easy to understand. If a patient of Pakshagata or Gridrasi, if he comes in the Avarana symptoms of Vakstamba and Ruja and loss of movement, all these things, but there is no that's degeneration of the muscles, anything. After 6 months he comes with all Dhatukshaya. Why it occurs? It is not Sarvanga Dhatukshaya is not there, that particular area only. It occurs due to Avaranat Dhatukshaya. In the Gridrasi, initially he comes with the severe pain, all these things, Avarana symptoms, but after 6 months if he didn't take treatment, he comes with the degenerated limb. This Dhatukshaya occurs due to Margavarana, not due to Ahara Vihara Dhatukshaya. That is Cha. So if a patient comes in the stage of Dhatukshaya, your treatment should be Brahmana. If he comes in the stage of Avarana, your treatment should be Karshana Chikitsa, Avarana Hara Chikitsa. That is why we have to diagnose each patient. Patient has come in Avarana stage or Dhatukshaya stage. If it is comes in Avarana and Dhatukshaya stage middle, he may be have 60% Avarana, 40% Dhatukshaya, 50% Avarana, 50% Dhatukshaya, 30% Avarana, 70% Dhatukshaya. Your treatment cannot be same for each patient. So, individualistically you have to diagnose the case, how much percentage of Avarana Dhatukshaya is there. That you have to diagnose before giving the treatment. Should you give Karshana Chikitsa or Brahmana Chikitsa? How much Karshana you have to give? By Karshana you should not get Dhatukshaya. That we have to diagnose. That is why Vaidya is there. Vaidya word itself is with Vijnane, Karya Karana Vivechita Jnana. So Vaidya does the Karya Karana Vivechana, does the diagnose how much Avarana Dhatukshaya, that diagnose and give the proper treatment. So there cannot be same treatment for each patient of same disease. Now here, I want to explain what is this Avarana and Dhatukshaya. Usually, most of them, especially students, they could not understand what is this Avarana and Dhatukshaya. So this can be understood by a beautiful simile of a river. You see, for example, river is there. In the rainy season, it is full of water. What happens in summer season? From Moola Srotas itself, it is completely dried. It is filled with what? Filled with what? Filled with the air. Dhatukshayat Vata Prakopa. Dhatukshayat Vata Prakopa. Now what happens? Full of river flowing, in between you put a dam. KRS dam at Mysore. Put a dam. Avarana. Blocked. Then what happens? Due to that, there will be raise of the water level. That means moving pressure increases. Pressure increases. Avaranat Vata Prakopa. Vimarga Gamana gets Vimarga Gamana, you get the disease. Now what happened below stream? Because of this dam, below stream becomes dry. Avaranat Dhatukshaya. That's filled with air. So patient may be dhatukshayat vata prakopa, avaranat vata prakopa, avaranat dhatukshaya. When avaranat vata prakopa is there, you will have symptom of avaraka dosha. It is not anatomical, it is a physiological. If you open your body, you can't see kapha or pitta is avaran. It is a physiological thing. Physiologically you can experience it, but you can see anatomically. That's very important fact. So here, then question comes, how you will identify in a clinic? So because you are a clinician, you have to identify. When pitta avarana is there due to the vata, then there will be shula of vata symptom, whereas avaraka dosha symptom will be daha. See, pitta avare daha tushna shulam brahmastamaha kattvamla lavanoshta vidaha shitakamita. These are all symptoms will be there in pitta avarana. Santapa, daha, trishna, shula is only vata symptom. When kapha avarana is there, you will have shaitya shotha gurutvani kattvadipashayodikam langanayasa rukshoshna kamita. Shula is vata symptom, all other are kapha symptoms. Why I said the kapha and pitta is sarvangaja? These symptoms are sarvangaja symptoms. Then comes raktavarana. What he says, raktavrute sadhahartihi tvakmam santarajo brusham bhave saragah shvayatu jayante mandalancha. Mandalani shvayatu occurs. Wherever raktavarana occurs, there will be mandalani shvayatu occurs. And there will be daha and shula, arti, in between tvak and mamsa. This is a really confusing point. See, rakta and vata, both are moving entity in the body. If you see rakta and vata is sukshma and chala, rakta is sara and drava. If you compare vayu and rakta, vayu is sukshma than rakta is sthula than vayu. Both are moving. How one moving will block another moving? How you can understand this one? For this understanding, there is one simile. See, highway is there just behind this college. Highway, all the road, all vehicles are moving. Heavy vehicles, lorry, bus, at the same time, bike, scooters, everything is moving. If anywhere road is disturbed, Raktava Srotas is disturbed, what happens? Or any lorry is damaged, what happens? First, next comes heavy vehicle, lorry, bus, stops. Stops or not? Still you negotiate your bike. After some time, another 3-4 lorry buses comes, accumulation occurs. Due to this lorry buses, movement of your bike and scooters also stop. First, Rakta stops, then Rakta itself blocks the movement of Vayu. That causes Rakta Avarana Vata. In that area, accumulation of vehicles, that is Mandalani Shayatu. Mandalani Shayatu. I hope you understood. It's a very simple thing. Mandalani Shayatu. Right? Then heated exchange between drivers, Daha. Redness is Raga. Sparshadvesha. Loss of function. Immediately if you rectify this Avarana, by removing Avarana, it may flow. Otherwise what happens? From there, information goes to city center. In context of body goes to hypothalamus. In turn, whole body temperature increases. You get Santapa. So this occurs, this inflammatory swelling always occurs due to Rakta Avarana Vata Prakopa. For example, appendicitis, tonsillitis, sinusitis, meningitis, tubercular meningitis, or any inflammatory swelling, it may occur in the Tvak Mamsa Sirasnayu Sandhi Asti Marma Koshta. Anywhere it can happen. You get all these signs and symptoms. When it happens, to this happen, what should be prerequisite? There should be Rakta Dushti or Raktava Sroto Dushti. Otherwise it will not happen. What are the Rakta Dushti? There should be, there are told many Rakta Dushti Karanas. It is in Charaka, Vidishoniti Adhyaya, Pradushta Shitoshna Kamit, Pradushta Tikshna Ushna Madhya Tadvidehi, Atilavana Ksharai Katubirevacha. This Rakta Dushti cannot happen independently without doshas. Rakta is a dhatu. Its dushti can happen by Vata Swarupa, Pitta Swarupa or Kapha Swarupa. So first line is Pitta Swarupa Rakta Dushti, second and third is Kapha Swarupa Rakta Dushti Karana, Atidrava, Pindal Mulakadinam, Jala Aja Anupa, Bailanam, Dadi Amla, all these things. Fourth line is Vata Swarupa Rakta Dushti Karana, Vasa Raktadushti, then Rakta Vata Prakopa. There will be double Vata. Kevala Vataja, there will be severe symptoms of Vata will be there. When Kapha Raktadushti, Rakta Vata, there will be Kaphaja symptoms along with Vata and Rakta Varta Sparshadvesha, and it will be always Ekadeshaja, not Sarvangaja, always Ekadeshaja. If it is Pitta Swarupa Raktadushti, Rakta Vata Prakopa, Pitta symptoms of Daha, Brahma, all these things, along with that there will be Shula and it will be Ekadeshaja. So these symptoms will be there, or Dvidoshaja or Sanipataja. Anyway, Raktadushti, Rakta Vata Prakopa, you get these things. Here, and another thing is, by Abhigata also, it can cause. For example, road traffic accident or anything, there will be injury occurs. So Abhigata, Raktadushti, Rakta Vata gets Samshaya, you get at Tiryagadamani, you get Pakshagata. By Ahara Viharas, Raktadushti occurs, Rakta Vata Prakopa, Prakupitavat gets Samshaya, Tiryagadamani, you get Pakshagata. Then other than by and there are many Raktadushti Karana Vyadhis are different, are told. Mada, Morsanyasa, Pidaka, Santapa, many diseases are told. All this occurs due to Rakta Prakopa. And also another cause for this one, for Rakta Prakopa to get Raktadushti, that is Raktaja Krimis. Raktaja Krimi told in Sushruta, that is infections. Otherwise, you can't explain how tubercular infection can cause Pakshagata. Tubercular meningitis causes Raktadushti, Rakta Vata Prakopa, Prakupita Vata gets Sansamshaya, gets Runashota at Degadamani Urdu Deyaga, you get Pakshagata. So all three things you can explain by Abhigata, by Ahara Vihara, by Krimi. By any means there will be Raktadushti, Rakta Vata Prakopa, gets Sansamshaya at Degadamani, you get Pakshagata. This can happen. It can happen not only this one. In Grudrasi, in many Ekadeshaja Vyadhis, all occurs due to Rakta Vata Prakopa, wherever there is Sparshadvesha and Ekadeshaja Vata Vyadhis. Ekadeshaja Vata Vyadhis. Now it is clear that Rakta Vata Prakopa leads to Runashota, which can occur anywhere in the body. When you treat such cases, if it is Abhigata, your treatment should be Shalya Chikitsa, then Amapachana Chikitsa. Without doing Shalya Chikitsa, you can't do Amapachana. If it is by Krimi, first you do Krimi Chikitsa, then you go for Amapachana Chikitsa. If it is due to Dosha, Ja Raktadushti, you should go for Doshaja Amapachana Chikitsa. This is then resultant Ama should be treated. So patient presented with the Madamur Sannyasa along with the Akshepa or Pakshagata, cause of Raktadushti should be elicited in all the patients. Then we have to treat the. If it is by Doshaja Raktadushti, Dosha Amapachana. If it is by Abhigata Chikitsa and Amapachana. If it is Krimi Chikitsa, then Amapachana. If a tubercular meningitis comes with the Pakshagata, you can't give treatment for only Pakshagata, for Amapachana. First you should treat Krimi, then you go for Amapachana Chikitsa. So if it is a patient comes with the Shalya should be removed, then only Amapachana can be done. If it is Dosha Amapachana, your treatment should be Dosha Amapachana Chikitsa. So now how you should be treated such cases? When Pitta, Kapha, Rakta, all three doshas are involved, like in stroke syndrome, first your treatment should be Pitta Chikitsa, then Kapha Chikitsa, then Vata Chikitsa should be done. What is a Pitta symptom in this case? Pitta symptom will be Mada Murchanyasa. Now let us analyze what is treatment for Mada Murchanyasa. What he said? Sheka Avagaha Manayasara Shita Pradeha. Shitala, Sheka, Shita Avagaha, Shita Pradeha, Shitala Paniya. Then Pitta Jwarahara Chikitsas. Then Nasavadunakshina Murcha Prasaktam Shiro Virekai Jayeda Bhikshtam Amanesha Tikshne Tikshna Shiro Virechana and Tikshna Vamana should be done. Here question comes, you told it is occurs due to Pitta. How you are giving Tikshna Shiro Virechana and Tikshna Vamana? Is it not against the concept? Then for Dallan also same doubt arises. What he said, you see, Yadyapi Sarvamurchayam Pittam Pradhanam Tikshne Nasya Vamana Na Yuktaha. It is not right. Tathapi, even though what he says, Tathapi Sabnyamah sroto nirodha shantikrत्वात् vyadhi pratikanatvat hite eva. Sabnyamah srotas is get avarana by tamodosha. To remove that tamo avarana as vyadhi pratyangatva, you are giving tikshna, shirovirechana and tikshnomana. What he says, like that he says dosha vyadhi vipratyakitsa. Why I am saying here in this context, in Madhamur Sannyasa, always when you do Nasya, you give Abhyanga, Sweda and Nasya. But in this context, you should not do Sweda and Nasya. You have to do Shita, Seka, Shita, Alepa, etc. Then you have to give Tikshna Nasya. As Dosha Viruddha, you have done Shitala Chikitsa. Then you have to give Tikshna Nasya. If you do Swedana and Nasya, what happens? Patient will go to balcony. Immediately he will die. That state, in that acute state, you should